So in my previous video, I did a section where I looked at passing OSCE exams. And remember that one of the sections in passing the exams is being able to be tested on how to take a good history. So I thought to myself, how can I make something practical that people can follow along and get a basic idea of what I'm talking about? Because sometimes it's often easy to just say, I'm going to ask the patient this, this, and that, minus you actually asking a patient right in front of you. And the dynamics of this tends to change when there's a lot of anxiety from the examiner. So I decided to put along this practical guide of taking a good history. Grab a piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at medical topics in depth. Today we're going to be looking at taking a good history. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications of such amazing content every time I post. Remember that a good history is part and parcel of getting to the diagnosis and gives you about 70% of all the information you actually need to know in order to arrive at a diagnosis, to examine the patient, and to get the right clinical diagnosis. Remember, when you come to these history-taking stations, I will reiterate these points. I've talked about them in my previous video. Keep a format in mind. Have an organized approach on how you're going to be taking your history. Remember that there is a time constraint that's going to be there in the OSCE exams. You're not supposed to take this history forever and ever. You should manage your time wisely, and you should be able to cover all the essential parts of the history to enable you to make a diagnosis in the end, because this is preparing you to work in the emergency department. You should always assure your patient that the information is going to be confidential. It's underrated that the fact that people don't greet patients. They just go and read the question and begin to take the history, minus you actually saying, "Hi, my name is this," before you actually start taking the history. You should always ask for consent, and you should thank the patient afterwards. You should show some empathy and make it like a conversation. Don't make it robotic. You should be confident at the same time, but not too confident. Maintain a good eye contact with the patient, and of course, be an active listener. Also, look at the body language of the person that is in front of you. All these things are key to helping you get a good history. So here's a summary of the format that you must keep in mind when you're taking a history. You must have an appropriate introduction. You confirm the patient's name. You explain the reason for the consultation. You obtain the consent and establish rapport. You ask open-ended questions to elicit the presenting complaint. Get a history of presenting complaints. Get their past medical history, their family history, their drug history, any allergies, social history. You review your systems, though some people can actually put this much, much earlier. You should also explore, respond to ideas. Don't just stick to this format forever and ever. If the woman or the patient actually says something interesting, you could actually ask questions based on that, because that could be leading you towards the diagnosis. Show some empathy and also have some nonverbal skill communications. Avoid any medical terms. Keep it as simple as possible. You summarize everything. Ask the patient if they have any questions, and at the end of everything, make sure to thank the patient. So there are some commonly presented complaints that I talked about in my previous video, just to highlight a bit. They may ask you about things like chest pain, cough, hemoptysis, headache, shortness of breath, fever, weight loss, general lethargy and tiredness, abdominal pains, change in bowel habits, tiredness, someone who's just collapsed, rectal bleeding, jaundice, dysphagia, alcohol misuse, upper and lower GI bleeding, pervaginal bleeding, dysuria, hematuria, amenorrhea, postcoital bleeding, and even postmenopausal bleeding. So just some of the complaints that patients can present with. So as you're studying, as you're preparing for exams, make sure that you have a rough idea of a random symptom that can come to your mind. Suppose someone comes in and they have generalized body weakness. What would I do in the history? What questions would I ask in the history for me to arrive at a diagnosis? First of all, you must establish what is the possible diagnosis that you're dealing with, because that will help you now generate the questions that you're going to start with. So before we get into the examples, a special thanks to Abby Kaluba for actually helping me generate this video. So special thanks to her. If you ever see her, just give her a big shout out. And we'll go into the last two examples before we end this particular video. So Miss Kayla presents to the emergency department with a 2-week history of weight loss. Take a relevant history to arrive at a diagnosis. So keep in mind that this is a woman that has come in 2 weeks and they have weight loss. So it could mean a possibility of many things. It could be, for example, hypothyroidism. It could be, for example, diabetes. It could be, for example, that this patient actually has TB. So many things. So here's an example of how someone would take a history in this particular patient. Now, for this particular example, I wrote down the format here. So I want you to be following this as the audio is playing. So I'm going to play the audio and then I want you to be following the conversation and see how it goes. So have a listen to this. In this particular example, a student has been asked to take a history of a patient that has presented with 2 weeks of weight loss. Have a listen to the audio. Hello, Ms. Kayla. My name is Moses. I'm a student at Pediatrics. I've been asked to speak to you about your symptoms. Is that okay with you?
Yes, it is.
So, I hear that you've been having some weight loss. How long has this been happening for?
The past 2 weeks.
Okay, and sorry to ask this, but how old are you?
35.
Okay, and did you experience any other symptoms apart from the weight loss? Have you been experiencing any night sweats?
Yeah, and I cough as well.
Okay, how long has the cough been there for?
2 weeks as well.
Okay, when you cough, is it a dry cough or does anything come out?
Something comes out.
And how do you describe whatever is coming out?
Slimy thing. Whitish and yellowish.
Is there any blood in it?
Yes.
Okay. And has it been like that or it's something that has recently happened?
It's been like that ever since I started coughing.
Okay. Apart from the cough, do you sometimes experience any difficulties in breathing?
Yeah, I do.
When is this worse?
At night when I lie down.
Is there anything that makes it feel better?
Yeah, when I lean forward.
Okay. And apart from that, have you been experiencing any chest pains?
I have actually.
Where? Can you tell me where exactly the chest pains have been?
The center of the chest.
Okay. And how do you describe these pains like?
Sharp, I would say.
Does anything make it worse? What makes it worse?
When I lie down again.
Okay. And what about, does anything make it better?
Yes. No.
Not even painkillers?
No, I haven't been taking painkillers actually.
So you say this pain is in the center of your chest, right? When it comes on, does it spread to any other part of the body?
My legs at times.
Okay, so the pain spreads from your chest to your legs, or your legs have also been hurting?
No, the pain spreads to my legs.
Okay. And during the same period that you have been experiencing these symptoms, have you noticed any swellings on your body?
Yeah. Yes.
Where exactly have you noticed them?
My neck. On my neck.
How did you notice them?
They pain, so it's easy to notice.
Okay. And have you had any abdominal pains?
Not really.
Any diarrhea?
Once or twice.
Was there any blood in the diarrhea?
Once.
Have you noticed your stomach swelling?
No.
Okay. Now I'm just going to ask you a little bit about your medical history. We'll be done very soon. Do you have any history of any chronic conditions that I'm going to mention? Do you have any history of TB in the past?
No. But now that you've mentioned, my cousin came to visit and she was found to have had TB at that time.
Okay, how was she found with TB?
She used to cough a lot and she visited the clinic and they took a sample of her sputum.
Okay, and was she started on treatment?
Yeah, she was started on treatment, but after some time, after a while.
Okay, and how long did you stay with this cousin?
Over a month.
And have you checked your HIV status before in the past 3 months?
No. I don't actually know my status.
Okay. Do you suffer from diabetes?
No.
Have you had any have you been found with cancer in the past?
No.
Are you on any medication that you would want me to know?
No.
Do you smoke or drink?
I used to smoke in the past.
How much were you smoking?
2 cigarettes a day?
Okay. And you've never taken alcohol?
No.
When did you stop smoking?
2 months ago.
Okay. And I would just like to ask you just a few more questions. What kind of job do you work?
An office job. I'm a secretary.
Have you ever worked in a mine?
No.
Okay. So, Mrs. Kayla, I would like to give you the opportunity to ask me any questions. If you have anything that you feel is important that you may tell me. Do you have any other questions for me?
No, thank you.
Okay, so from here on, I'm going to perform a physical examination and assess your chest to see if there's anything that may lead me to the diagnosis, because I feel that you may have TB, but we're not yet so sure about that and we need a few more investigations. But thank you for taking your time to answer all these questions that I had for you.
Thank you, doctor.
So notice how the history has been taken in a concise manner, and this is one particular way in which you can actually take the history in such a scenario here. You can already tell that the way the student is interacting with the patient, it's sort of leading in a way that at the end of the time, you can actually have a diagnosis or possibly have an idea of what this patient is most likely going to have. This is one way in which you can take a history if you're taking history from the patient. There is another way in which you can take the history, for example, if it's in terms of a collateral history. This becomes very common, especially in the pediatrics department, and I have put an example to show you guys. So, example 2, Mrs. K brings her 5-month-old infant to the emergency department with history of diarrhea. Take a relevant history. So here again, this is a woman that has brought a child that's 5 months having diarrhea. Many things can actually cause diarrhea. Could be infections, it could be due to formula, and of the infections, most of them are viral in nature. Sometimes it could be due to some non-infectious things like medication that the child may have been given. So again, have a listen. I've left the script on front of your screen in the next slide. Have a listen to see how the history is taken. And remember, these things were done within the allocated time. So it is possible to ask all those questions that I usually beam when I'm revising these OSCE stations, so that I did this so that you can have an idea and you can know that you can actually take this history within the stipulated time. So here I will play the audio. Have a good listen. In this particular example, Mrs. K brings her 4-month-old child with a history of diarrhea. Listen to the audio and learn. Hello, Mrs. K. My name is Moses. I am a final year student from Apex, and I have been asked to speak to you about your child that you have brought in that's not feeling so well. Is that okay with you?
Yes, it is.
Okay, so I hear that your child has been having some diarrhea. How long has this diarrhea gone on for?
Just a day.
Okay, and how many times has the child changed the diaper?
8 times.
Okay, this 8 times was since when? Since when the diarrhea started or before?
Since when the diarrhea started, because I usually change 6 diapers a day.
Okay, and have you noticed any fevers in this child?
Yeah,
When did the fever start?
the same period the diarrhea started.
Okay, and how would you describe the diarrhea as?
It's watery.
Is there any blood that you noticed?
No.
Have you noticed any, like as if the child is having any uncomfortability when you touch their stomach?
Yes. She cries actually a lot.
Okay, and have you noticed any swelling of the stomach?
Yeah,
When did this happen?
the same day.
Okay, is your child able to pass any urine?
No.
How did you notice that your child is not able to pass urine?
When removing the diapers.
Okay, and normally, how many? You said you change 6 diapers in a day when on a normal day.
Yeah.
Would that just be urine, or it would be mixed with poop?
It would be mixed with poop.
Okay. And when you notice that your child has been having this diarrhea, why didn't you come to the hospital earlier on?
I'm actually a businesswoman, so I'm not usually around. So I wasn't around. I left my child with the maid.
Okay.
So after she knocked off at 17, when I came home, she told me that the child is not feeling okay.
And when this child has been having these episodes of diarrhea, have you noticed the child vomiting?
Yeah.
How many times has the child vomited?
2 times.
Okay. Was there any blood in the vomiters?
No.
What was in the vomiters?
Just milk.
Okay. And you say that the child vomited milk. Is this child breastfed, or how do you exactly feed this child?
Is breastfed, but since I'm a busy woman, we use formula as well.
And have you taught who makes the formula?
The maid, since I'm not usually at home.
Have you taught her how to make the formula?
I have taught her how to do that.
And does she make it right?
I don't think so, because one time I caught her using tap water.
Did she at least boil the water?
No.
Okay. And when the diarrhea started in this child, have you noticed any changes in the terms of activity of this child?
Yeah. She's been low.
Okay. And have you noticed any changes in terms of her eyes? Do they appear normal to you?
Not really. They appear dry.
Okay. Have you given this child any medication ever since this diarrhea started?
The maid told me after she noticed the symptoms, she made salt and sugar solution in a cup.
Okay. Quite interesting. And
gave the child.
okay. So in terms of this maid, where do you get your water from, or where does she use the water to make all this?
We use mineral water, but she uses tap water. I told you, like I explained before, I caught her once using tap water. So I'm sure even the salt and sugar solution, maybe she might have used tap water as well.
And where do you stay?
Jalal.
And do you have a borehole, or is it tap water coming from the normal system?
Tap water coming from the normal system.
Okay. And do you have an indoor or an outdoor toilet at your place?
An indoor.
Okay, it's a flushable toilet?
Yeah.
Okay. And just a few more questions. Have you checked your HIV status before, and has this child had an HIV status?
Yeah, I have when I was pregnant and I was negative, so they never tested the child because I was negative.
Okay. Do you have anything else that you would want to tell me?
Yeah. The maid comes from this one of these places, the shanty areas, so I think she's not okay in terms of sanitation. She's bad.
Okay. What do you mean? Where does she dispose of the diapers? Or is it in terms of when she's preparing the formula for the baby? Or it's just everything in general?
In terms of handling the baby, yeah.
Okay. Is there anything else that you would want to mention?
No.
Okay. Thank you very much for giving me those answers. And we will indeed have a look at your child, examine your child, and we will inform you and update you on the next steps that we're going to be taking as for now. Thank you.
Thank you so much, doctor.
Okay, so as you can see in this particular scenario, you can hear for yourself that the mother is giving a collateral history on basis of the child that has been having diarrhea. Of course, there may be some things here and there that may have been missed, but the fundamental key thing about history taking is that it's a dynamic process and it's constantly being improved. Unlike with physical examination, where there's a ceiling to how good you can get, And at picking up this clinical science, history is something that you must practice each and every single day. I really hope you enjoyed this video on history taking. If you enjoyed such practical videos, please drop a comment below to show some support. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.